Hi, good evening. This is Dr. Julie Zweig, and I'm very excited to be here today. So, we are going to be talking about a very touchy subject, one that people don't really like to mention in public, but it's something that we all have, and that is earwax. So, let me tell you a little story. I have a patient who came to me. She was convinced that her hearing had completely gone away, that she had lost her hearing completely, and she had tried everything in the world. She had tried ear candling, she had tried standing on her head, or doing a headstand, she had tried putting water in her ear, and she couldn't get her hearing back, and she came to see me, and sure enough, all it was an ear canal full of earwax, and it was easily solved. But let's talk about earwax. So, first of all, what is the purpose of earwax? Well, believe it or not, earwax is bacteriostatic. So it means that bacteria will not grow while the earwax is there, while it's in the earwax. So that keeps bacteria from growing, which keeps infections down. So that's one thing. Another thing that earwax does is it makes the ear feel what we call copacetic. It makes the ear feel normal. And when you don't have earwax and when you take it all out, or somebody takes it all out, sometimes your ear actually feels more stuffy than it was before. So the earwax actually makes the ear feel normal, and it's bacteriostatic. Now, there are little hair cells in our ear canal that are in the outer 1/3 of our ear canal that help push this earwax out. And as long as the earwax is within that outer 1/3, the earwax will be pushed out on its own. We have a self-cleaning mechanism, basically, or a self-cleaning oven, however you want to look at it. However, if that earwax gets pushed past that 1/3 of the canal, outer canal, then there's nothing to push it out. And at that point, the earwax can build up and actually block your hearing. And that is not a good thing. Now, what do we do when that happens? Well, if that does happen, you need to see your doctor. And many doctors can clean out earwax, but it really is a good idea to go see an ear, nose, and throat doctor and let them clean out the earwax, because they have some specialized instruments and they usually use a microscope, and they can get the earwax out pretty easily and safely. Not saying other doctors can't do it, it's just a little bit easier when you have all of the equipment. So, what should you not do for earwax? Well, the first thing you should not do is use Q-tips in your ear. And the reason for that is the end of the Q-tip is actually pretty much the same size as the narrowest part of your ear canal. So if you push the Q-tip in deep, you can push that earwax further into the ear canal, and it will never come out unless somebody takes it out. So Q-tips are actually not good to use in the ears. And actually, if you look on the box of Q-tips on the back in bold letters, it does say, do not use Q-tips in the ear. Nobody ever notices that. It's something that is bold and easily found, but not everybody can see it. So I do recommend not using Q-tips. So what happens if you do get earwax? Like I said, you can go see your ear, nose, and throat doctor. Also, you can try a little bit of mineral oil in the ear or hydrogen peroxide in the ear, and that will soften the wax, and sometimes it will actually come out on its own. If it doesn't, you know what to do. The other thing I want to mention, which a lot of people ask about, is ear candling. Does ear candling work? Well, many people say it does, but from my experience, ear candling does not work. In fact, it can often make things worse in the ear, and I have actually seen a burn in the ear canal from ear candling. So no, I do not recommend ear candling at all. Hopefully, your earwax will come out on its own from the little hair cells, and you won't have to worry about it. But if it doesn't, feel free to see your local ear, nose, and throat doctor. It's been a pleasure speaking with you. Once again, my name is Dr. Julie Zweig. And if you like this video, please send me a little high five, and I will talk to you soon. Thank you. Also, if you want to look me up, my website is www.juliezweigmd.com. Thank you.